can catch up later. I wanted to welcome everybody to our week 1 of You Make a Difference, our Lunch and Learns. The week 1 is titled Self-Care with a self-care theme. So I'm glad that you guys could make it. And please know we are recording, so you can share this with your other colleagues if they were unable to make it. Just a couple housekeeping items. We encourage you to join by camera if you're able. Keep your microphone muted when you're not speaking. Be present and focused. Try to avoid multitasking. Lean into the content. And I will start by introducing two of our speakers. We have Dr. Amelia Schlak. Amelia is a postdoctoral research fellow at the Columbia University School of Nursing, specializing in comparative outcomes research. She completed a PhD at the University of Pennsylvania in the Center for Health Outcomes and Policy Research as a Robert Wood Johnson Foundation Future of Nursing Scholar. Her research focuses on nurse workforce issues, particularly nursing burnout. As a nursing outcomes researcher, she is focused on the contribution of nursing to improving patient outcomes that are of national policy interest, and particularly those related to healthcare delivery reform. Also joining her is Emily Ishado. Emily is a geriatric clinical social worker with over 15 years of experience working in multiple healthcare settings, including skilled nursing facilities, geriatric mental health, outpatient primary care, and home health. She is currently a program and research manager at UW School of Nursing, focusing on dementia education initiatives and dementia care partners self-care interventions. Additionally, she works as a behavioral health provider at Providence Health Systems, where she provides counseling to healthcare providers, including doctors, nurses, medical assistant staff, and their families. So as you can see, we have a power couple here to talk to us today. So I'd like to pass it to you, Emily.
Hi, good morning. Yes, thank you. And I'll start by sharing my screen. Okay, does that all look okay? Okay. Well, thank you so very much for having me today. Happy Nurses Month. And yes, as Doreen said, I've been working in healthcare for over 15 years, meaning that I've worked with dozens and dozens of really wonderful nurses and have been inspired and able to see the amazing magic that you guys do every day. So thank you so much for having me here. And yes, I'll be presenting on our theme for week 1, which is self-care and develop self-care habits. So first, before we begin, just want to talk a little bit more about what exactly is self-care. So, that concept of self-care, there isn't actually a lot of consensus. There's all these different definitions and different ways of viewing it. But some general characteristics to keep in mind when looking at self-care.
Emily, you went on mute.
Oh my gosh, I'm so sorry.
There you go. You're good.
Thank you so much. Let me start over. So you didn't hear me at all. Can you hear me now?
We were hearing you, and then mysteriously you went on mute. So we heard part of what you were saying about self-care.
Oh, okay. Interesting. So it involves.
So start with the definition of self-care.
Oh, okay. Very good. Okay. For self-care, while there are various definitions, the one that I like that I think really helps frame what we're going to be talking about today is at the bottom half here, of where personal self-care is defined as a process of purposeful engagement in practices that promote holistic health and well-being of the self. And then professional self-care is that process of engaging in practices that promote effective and appropriate use of ourselves in the professional role within the context of sustaining holistic health and well-being. So kind of in other words, it's basically those actions or behaviors that we do to care for ourselves, to promote our own health, and the actions and things that we do to care for ourselves so that we can engage in our professional role. So why do we want to engage in self-care? Why do we talk about it? Why is it important? Well, one, we know that it does mitigate the effects of stress, which therefore also then reduces our risk of burnout and compassion fatigue. Self-care helps improve our physiological and behavioral health outcomes, which could be, lowering our blood pressure, improving our mood, our energy, and our concentration. And additionally, I wanted to talk a little bit more about some of our initial results based on our self-care intervention that we did with dementia care partners. So we piloted an intervention where dementia care partners selected a self-care behavior or a goal that they would do over the course of 4 weeks. And over just this period of 4 weeks, they reported that they felt more at peace. They were feeling more hopeful. They had less strain or frustration. And for anyone that might know about caring for someone living with dementia, it is a very straining and stressful and challenging role to have. They were also having more patience. And so as a result, when they were having more patience, it also affected their care recipient, who was calmer. And I think this is like a good example of how caring for ourselves really can help and affect those around us. So if you can imagine, you're spending time with someone who's really calm and content, sometimes that can help us to feel, calm and content as well. Versus, if you're with someone who's really angry and frustrated, well, we're naturally, empathic human beings, and sometimes we can start to experience some of that emotion too. And I think this is a lot of what was happening with our dementia care partners and the person living with dementia. As they were taking care of themselves, feeling better, the person living with dementia definitely was picking up on that, and they were becoming more cooperative, more, less resistant to care, and their behaviors were improving too as a result. These dementia care partners seemingly they were feeling less helpless. They were gaining a sense of control. A lot of times as a caregiver, there's just so much that's out of your control, right? The outcomes of what happens, you can control what you do, but you can't control really what happens as a result. And so, that can certainly be angering, frustrating, stressful. But it seems that as they were engaging in self-care, they had this increased sense of control, because I think they know that there is something that they can do that is something for themselves, and that they have that sense of agency and control over. Additionally, I was talking about this study, it was a 4-week period. And, as we were looking at, the situation and how they were, evolving over this period of time, their situation did not change. They were care partners of someone living with dementia. The dementia does not get cured, as we know, or get any better necessarily. But their attitude and their way of interacting seemed to change. They were having more increased level of acceptance, and then they were having an easier time themselves in really engaging in their caregiving role. And as a result, doing this one self-care activity also seemed to sort of have this snowball effect. There was this sense of, when they saw I do this thing for myself and I start to feel a little bit better, like exercise, for example, of one person, this person then started to think about all the other aspects of his life that he could change. Like, well, what about diet? Maybe I should improve my diet. Maybe I'm going to go and see a therapist for myself as well and really work through some of these challenges. And so it really has this wide-ranging effect when we take that time to care for ourselves. And most importantly, I think a lot of the care partners came to understand that you do need to care for yourself before you can give care to others. We say that a lot, but they lived it and understood it, that self-care is not selfish. And my way of sort of understanding that process right now is that I think some of these care partners, they lose that sense of individuality, that sense of agency, that sense of value and who they are as a person. And because, their primary responsibility is just, what do I do to take care of this person living with dementia, right? Everything that they think about is directed and driven by, okay, the person living with dementia needs this, this, and this, so I have to organize myself in this way. And so I think they sort of lost this sense of self. Thereby, when they started to respect and value and prioritize their own needs, I think they started to regain that sense of self and identity, that sense of value. And it resulted them overall in feeling better. And I think this concept can, be applied also to a lot of us who are in that healthcare field, where our job is to look at the needs of other people, before our own. And maybe sometimes even losing that sense of self or that sense of agency. And therefore, it's really important to care for ourselves, respect our own needs and our own value, so that, yes, we can still continue to care for others. So next, what is a self-care activity? It can be anything. So again, reflecting in our pilot study, when I would talk to the care partners about self-care, a lot of them were talking about, well, I don't know, do you mean like I should get a massage or get a manicure? I mean, I don't have time for that. But really, self-care can be anything. It's anything that brings you joy, that feeds your soul, that maybe rejuvenates you, that kind of fills your own cup and gives you that energy to continue doing the things that you want to do or need to do. And just in case if you need some kind of suggestions, we utilized a tool in which we divided self-care into 3 main categories. The first one being universal, and these are things you need to do to be alive. So kind of like the eating regular meals, drinking water, staying hydrated, getting enough sleep, taking your medications as prescribed. And then there's some other health promoting activities that you can consider. That would be like doing exercise, sports, outdoor activities, listening to music, reading, watching TV, any sort of meditation or spiritual activities. And then of course, definitely social interaction and social connection. So spending time more with your family, friends, pets. And then some like professional developmental types of activities. That could be things that you kind of do within your professional role. Could that be maybe setting boundaries, asking for help, or things such as getting education or training on things that are currently really difficult and stressful for you, so that maybe it can also reduce some of that stress or strain when doing some of those activities. So here's just some examples to think about. So now we're going to start working on and looking at how do you develop a self-care habit. And this would involve 3 main steps. The first one is just start thinking about, inventorying your own views. How do you feel about self-care? What do you currently do for self-care? Then setting an objective, measurable goal. So I'm sure you guys are familiar, get a SMART goal in place. And then lastly, developing it into a habit and making it more of an automatic behavior that you do. Okay, so let's talk a little bit more about step 1. So when you're doing an inventory, first just start to think about how do you define self-care? What does it mean to you? And perhaps, for example, for me, I might say, well, I think, self-care is an activity in which I do something nice for myself or something to help me feel better. So that's what I kind of consider self-care to be. Then how do you feel about engaging in self-care? What are your thoughts on it? Is it important? Is it not important? Are you not sure? And so maybe I ask myself, how do I feel about self-care? Well, I think it's good. People tell me it's good, but I don't really think I have time for it. And then start asking yourself as well, what are your current practices? What kinds of things do you do for self-care right now? And me, I'm thinking and I'm just like, well, I guess I play tennis pretty regularly. That's been a good outlet. So I enjoy doing that. And then start to think of what self-care activities, based on how you define it, things that, make you feel good or something nice for yourself. What kind of self-care activities would you like to do more of? And, as you're, thinking about this, are there things that you've been wanting to do, but just haven't started to do yet? Again, reflecting back in our study, we found that some of our care partners were even already had this thought of, yeah, I want to do self-care, but I just can't. I mean, I just don't have time. It's too much. It's all this, but there was something that they had already started thinking about, like, I wish I could do this a little bit more. And keep those things in mind, things that you even think aren't really possible right now. Keep that in mind. And so, for example, what self-care practices would I like to increase? Maybe I say, I'd like to do more running. I'd like to do meditation, hiking. I'd like to improve my diet. I'd like to spend more time with friends. And then we get to our second part, is making the SMART goals. So specific, measurable, achievable, realistic, and time-based. So as you're thinking, you have like a set of things like, here are a few things that I've been thinking about that I'd like to do for myself. Start looking at those items and ask yourself, what is most important and would have the greatest impact on your overall well-being? What do you think would, be most helpful and most beneficial? And once you select that, really start asking yourself why. How is it going to benefit you? And as you go through this, it's really like kind of doing motivational interviewing on yourself, but really continue to just break it down. Why, how, what, in what way is it going to benefit you? What will happen then as a result? And so maybe I decide, I think running is important to me and it would have the greatest impact. Yeah. And so why? How is it going to benefit me? Well, I think I'll get into better shape. I'll probably have more energy, and I think I'll just start to feel good about myself, and then what? How is that going to benefit you? Well, I'll probably be, proud of myself for accomplishing this activity. I think I'll probably also be stronger. And then again, why? Or, how does that benefit you? What happens then, when you feel proud of yourself? Well, when I'm proud of myself, I know I'm going to be happier and I want to be happier. And even then again, ask yourself, how is that going to benefit you? What's going to happen once you're happier? What does that mean? What does that even look like? And then I might think to myself, yeah, if I'm happy, I know I'm calm. And when I'm calm, I enjoy my life more. I know I can be more present for my friends and my family. And that's what's really important to me. So keep asking yourself these questions. Why, how, what is it going to look like when you start to, engage in this self-care activity? And what this does is it really starts to help you to connect to the value of this goal and how it's going to benefit you and kind of increase that motivation. So once you have that, I'm like, okay, I'm going to do running. I'm settled. Start small, right? Start setting a goal, but try to start small. So let's say, I'm thinking to myself, what's something I can do with running? What do I want to do? Well, I've done a lot of 5Ks. I've done half marathons. I definitely should be able to do 2 miles every single day. But then really ask yourself, does that feel achievable and realistic? And so then maybe I think to myself, oh gosh, I haven't run in years. I'm pretty out of shape. Probably it's going to take me a long time to run 2 miles, and I don't know if I have all that time. So then what is more achievable and realistic? You know what? I can definitely run a half mile. I know I can do that. And then you want to start working on the action and the time and the location to make it very specific. And so basically that would involve, I will do X at Y time in Z location. So for example, I might say, I will run at least a half a mile at 8 a.m. on my treadmill in the garage. Okay. So once we have developed that goal and, exactly specifically what we want to do, start to think about, this is where we're going to start turning it into a habit. And so think about the action and the time and the location of the goal that you want to do, right? Okay, so I wanted to run on my treadmill at 8 in the morning, okay? Then think about what is an existing habit or an existing thing that you already do that is close or similar in the time and the location. So I'm thinking to myself, what do I do in the mornings? Well, basically every morning I wake up and then I go and use the bathroom and brush my teeth, right? So brushing my teeth is kind of the last thing I do after I'm done using the bathroom. Then you want to create a plan to connect this new action, which is going to be, I want to run on my treadmill at half a mile at 8 a.m. in my garage, to this existing habit, which is I always brush my teeth. Every morning that wakes me up, I brush my teeth. And what you're going to do is you're going to stack these habits where you're going to use the current habit that's already in place and tack on the new habit that you're wanting to do. Therefore, it would look at something like, after I brush my teeth in the mornings, I will run a half a mile at 8 a.m. on my treadmill in the garage. So I wanted to just take a little bit of time to talk a little bit more about, for those of you who do try to take on a new self-care habit, a little bit more of what is going on and the processes that are involved in habit forming. So when you're doing, a new habit or doing a new behavior, you have a cue, and that's the thing that's going to trigger your brain to start a new behavior. And so for purposes of what we're talking about, my trigger is the existing habit. The existing habit of brushing my teeth is going to be the thing that is my reminder or trigger to my brain to initiate my behavior. And I must say, when we were starting to develop the study that we had piloted, at first we could not figure out how we were going to help these care partners to, start doing this behavior and remind them. And then when we found this, book on habit stacking and atomic habits, that really helped us to develop a built-in cue system so that they have a way of remembering to do a new behavior. Then the cue, then the next part of that is the craving. And that's the motivation or the desire for the outcome of the behavior. And so the reason why we were asking you to keep asking yourself, why is running important? How is that going to help you? How is that going to make things better? What is your life going to be like? That starts to increase your motivation and connection for the ultimate desire of where I'll be happier, I'll be calmer, I'll be more present, I'll be able to spend time with my friends and family. So that part is the craving. After that, the craving will then lead to the response, which is actually physically going out into my garage and running on my treadmill. In which case, after the response, you get the reward, that positive outcome. And one of those positive outcomes was like, I'll feel good that I accomplished something. And of course, with exercise, you get that endorphin release as well. But I'll feel good that I did something for myself. I'll feel good that I accomplished something that I wanted to do. And then, as you see on the right-hand side, it all starts to become a loop where the reward then again leads into the cue to kind of help initiate the cue again to the craving, to the response and the reward, where it kind of becomes circular in that it starts to develop more and more over time to becoming a new habit. And then I wanted to talk a little bit too about neuroplasticity and just also the process of, developing new habits and new behaviors. So on the left, you see that there is a strong pathway. And so in the brain, there's a strong pathway in the brain. It's very well defined, very clear, very open. And the strong pathway is like your kind of current habits or the current things that you do right now. That's part of your routine. And so let's say my current habit or pathway is wake up, use the bathroom, brush my teeth, go back to bed and look at my iPad. That's kind of what I know what to do right now. And that's how I kind of usually do things. However, on the right, you see it's a weak pathway. What I'm trying to do is develop a new habit and a new pathway in my brain to say, nope, after I brush my teeth, I'm going to go and run on my treadmill. And that's a weaker pathway. As you can see, it's kind of lighter. It's not as well defined. Maybe it's a much more bumpier road to get from A to B, which means it's kind of a more difficult for us to build this up initially. And the reason I wanted to talk about this is because starting new habits, new behaviors is challenging. And at first, maybe you're not completely 100% on it. Maybe you miss a day here or there, maybe you forget, but just know you're trying to build up a new, stronger pathway, and over time, it will get there. So really to have a lot of compassion and kindness to yourself, and really keep encouraging yourself that, over time, you'll develop a stronger pathway, it'll get easier to do, and then eventually you'll get to your ultimate goal, whether that's to be calmer or happier, or, the primary effect that you're hoping to get from your new self-care activity. So thank you so much for listening, and certainly if there's any questions, I'd be happy to chat further. If not,
Emily, do you want to hold question till Amelia presents and then go
sure.
to Q&A for both of you?
Oh,
Why don't we do that?
Okay, thank you.
Hi, everyone. So I will share my screen. If you could just confirm that you can see it. We good? Okay, great. Oh, wrong one. There we go. I'm trying to make it so I can see all of you, but that's okay. We'll worry about that later. So hi again, I'm Amelia, and just, thanks for coming today. I'm excited to talk with you all. As we talked about briefly in the beginning, I do study nursing burnout, so I'm excited to share some of my research and how that translates to practice. Please connect with me by email or on LinkedIn if you have any other questions. And this is really kind of in support of some of the strategies Emily said, being that these are institutional strategies which should be kind of foundational to help individuals engage in self-care. So we will. But before we get started, though, I want to provide a quick overview about what I'm going to be talking about. So I'm going to talk about what burnout is and is not. I'm going to discuss some of the causes and particularly some of the misconceptions about burnout, particularly in relationship to COVID-19. Then I'm going to kind of wrap up with some institutional strategies that hopefully your institution is already doing, but if not, maybe things that you could bring up to your leadership, and then open up for questions and discussion. So burnout is an occupational phenomenon, and it's characterized by 3 defining features, including emotional exhaustion, cynicism, and low self-efficacy. And anybody can experience these feelings, but what makes burnout is its relationship to the work environment. So there are a number of ways in which a poor work environment contributes to burnout. And when we look at what these things are, there are consistent predictors regardless of occupation or work setting, or even clinician type. So you'll probably see some themes. So the first is heavy workload, and this is when a person has too much work to do without enough time or resources. The most common way that this is defined for nurses is through nurse staffing levels, but there are other considerations that I'll talk about later. The second kind of area is level of autonomy. And if you don't have enough autonomy to kind of change your working circumstances or your workflow, or you're not being able to be a full participant in the organization's decision-making, that can also influence burnout. And then kind of piggybacking on this is poor administrative relationships. And this is really the tone for this is set by the administration, leadership, and management in an organization. And then lastly, if you experience hostile working relationships with your colleagues, this is also a consistent predictor of burnout. And this could really be among nurses, with nurses and nursing assistants, with physicians. As a few examples, the point is that if you work with someone and you don't have a good relationship with them, it does affect your work, obviously, but it also affects your experience of being burned out. So you can see that burnout is not about the individual, but more a reflection of the context that someone is working within. And so one of the main things I kind of want you to take away from this presentation is that burnout is not about you, it's about your organization. And you should never feel bad for being burned out. And there are steps that organizations should take to support your well-being. So consistent with this understanding, in 2019, the World Health Organization defined burnout as an occupational phenomenon. And really, it's to highlight that burnout is tied to the workplace. So the next kind of important point I want to make is that burnout is captured and most well understood within a system context. And this is highlighted well by this quote from sociologist David Mechanic. And here he's highlighting that burnout is really too powerful for a single individual to overcome. So he said job stressors are not amenable to individual solutions, but depend on highly organized cooperative efforts that transcend those of any individual, no matter how well developed personal resources. What this is saying is that the things that lead to burnout, it doesn't matter, how resilient or strong your coping skills may be, your organization really has to play a strong role in kind of addressing these features that lead to burnout. So to sustain nursing and the broader clinician workforce, it's really important to talk about the difference between unavoidable occupational suffering, and these things are inherent to nurses' role. So this might be bearing witness to patient suffering, death and dying. It also could be experienced as things that nurses experience in their role that cause extreme stress at the individual level. So it may be preventable at the systems level, but at the individual level, it's something that a nurse cannot prevent. But then there's also avoidable occupational suffering, and these are systems failures that can be prevented. So these are the things I talked about where leadership and management can take a central role on kind of helping support other clinicians and nurses in their work. So the first misconception I want to talk about is that clinicians are burned out and leaving their job because of COVID-19. I think more accurately, what the research shows is that COVID-19 has brought public attention to problems that have been long-standing and existing for decades. And so if we focus really on COVID-19 as, our only solution, or how we should build our solutions around addressing burnout, we're missing kind of the point that we have to look at some of these features that were present before COVID-19 to fix burnout in the future. So the other kind of thing is, right, like I said earlier, but the pandemic has essentially exposed and amplified long-standing occupational circumstances for nurses. And so these are kind of some of the things we need to focus on and address, particularly the role of systems leadership in addressing these things. And so for reference, some of the recommendations I'm going to talk about are outlined in a study or a research paper that I led that was published in January of this year. You can download it from Nursing Management, but also it's adapted. So these recommendations are adapted from the 2004 National Academy of Medicine report. And you'll see that the title is Keeping Patients Safe, Transforming the Work Environment of Nurses. And the point being here is that the things that are good for patients are also good for nurses. And there's like a natural tie between clinician well-being and patient well-being. So these are the 4 thematic areas I'm going to walk you through. And so autonomy, working relationships, resources and workload, and administration, leadership, and management. And these are really geared towards how leaders can address these things, systems leaders can address these things. But I know that we have several probably clinicians on the call. And so I would encourage you to think about how you can partner with your leadership to kind of address some of these areas to improve your working conditions. So the first theme is autonomy. And so autonomy is really important in ensuring that those who are carrying out the work have control over their day-to-day responsibilities, and essentially that they're involved in the decision-making for how their workflow is set up and carried out. And so we should really focus on reevaluating processes and scrutinize if they are necessary for the delivery of safe care. We should kind of give special attention to things that are high priority and time intensive. Good examples would be, admitting a patient or medication administration. These might vary by setting or unit though. The second feature of autonomy is thinking about the structure of your organization. So is it a very vertical or hierarchical organization or a flat organization? So a vertical or hierarchical organization means that each decision that must be made has to be leveled up to another level of leadership before change can be implemented. And so what we want to see is a decentralization of decision making. So that way point of care nurses or point of care clinicians and those who are their direct supervisors are empowered to make changes to improve their workflow. So the next is working relationships. And this is really important. And I kind of want you to think about how we can focus on fostering interdisciplinary relationships. And so this is where I would think about how the well-being efforts of nurses can be aligned with the well-being efforts of non-nurses through collective initiatives. So this could be achieved through transdisciplinary training and education across health professionals, as well as a transparent dialogue about what are the barriers and facilitators to adopting such a model. The other thing that you might think about is how you can do interdisciplinary rounding or shared continuing education models for all clinicians on a continual basis. So the next theme is resources and workload. And essentially, we need to make sure that we have enough nurses and clinicians to get the work done and to care for patients. And staffing is definitely a really big part of this, but so are physical resources. And if it's in an inpatient setting, some of these physical resources might be like pillows for patient beds, patient recliners, IV pumps, vitals machines, physical resources that clinicians need to carry out their work. But the other component is definitely staffing. And so it's really important that we talk about staffing because you need enough nurses and clinicians more broadly to safely care for patients. And so part of this is based off of ensuring that nursing leadership or clinical leadership has control over staffing, and that staffing is based off of decisions on patient census and patient acuity, and that it's not only a budget-based decision. But that being said, I recognize that staffing is a complicated issue, and it's not necessarily something that an organization can solve overnight. So it's important to think about what are the organizational investments in nursing and how these have been linked with patient outcomes, because these things don't just affect nurses and clinicians, they really affect patients too. And I also want to highlight that these solutions that I'm pointing out to you do not occur in a vacuum. And so better staffing has to be matched with better work environment features. So if you have great staffing, but a terrible work environment, with hostile relationships and ineffective management, people are still going to experience burnout. But if you focus on one aspect of the work environment, but you ignore staffing, you're going to see the same issues happening. So you have to look at where are the areas in your organization that need improvement, and how can you bring up all of these areas to a level that's operating. So all of these themes are really important. The next theme and the last one is administration, leadership, and management. And again, this is important because these leaders set the tone for the organization. So I'd encourage you to think about how top leadership is or is not accessible to you. And I hope that your direct supervisors or your clinical leadership, nursing leadership, I'm hoping that you're able to connect with them on a regular basis and have FaceTime with them. I wonder if you're able to have the chance to connect with non-clinically oriented leadership and executives. So thinking about who the CEO or chief financial officer is for your organization. Do you know who these people are? They're very important decision makers. And the point is that we need to have leaders and organizations, that are making really important decisions that affect frontline providers. We want them to be accessible to frontline clinicians. And so a great way that you can ask for the opportunity to connect with these decision makers is, having the chance for them to engage in purposeful rounding where they visit the unit and connect with you to hear your concerns. Another kind of more, formalized way would maybe to have a monthly CEO forum or lunch with a director. These are great opportunities to hear staff concerns, but to also hear staff ideas and innovations because they're on the front lines and they have a lot of ideas about how we can improve care and make things better. So the next idea is a well-being governing board, and I'm seeing that this is becoming more popular across organizations. And essentially what we want is robust clinical representation on these boards. And we want to expand our focus to be on physical, psychological, spiritual, and moral well-being. And so the first part is we need to have leaders, clinical leaders, managers, administrators, financial leaders, but most importantly, direct care staff. And the goal of these boards should really be to identify managerial, policy, and financial decisions that affect care and contribute to or degrade well-being. And we want all of our stakeholders, our big decision makers, really educated on what's the relationship between administrative oversight, management practices, and budget allocations on clinician well-being and patient care. And the next part is to create and monitor standards that would protect well-being. So a good example of this for nurses in an inpatient setting is voluntary or mandatory overtime, or even having time to take a personal break in the middle of your day, making sure that there's time and resources to take an adequate lunch break. So the next component of this is professional development. So individuals are not only looking for work with a job, but a career with upward mobility. And so I encourage you to think about how your organization is supporting you in your professional career path. And so some organizations do this really well for nurses in terms of clinical ladders and promotion opportunities. But there are other ways to think about this too, in terms of what are your opportunities for continuing organization, what's your opportunity to transition into a new role, a leadership role potentially. And one of the ways that your organization can be proactive about determining this alignment between your professional development and kind of their needs as an organization is through an individual development plan being incorporated into annual evaluations. So this is really helpful for organizational leaders and you to proactively identify what's this alignment with your professional goals and organizational needs. So lastly, I'll just say that, again, if you're feeling burned out, it's not your fault. Your organization has a responsibility to create an environment that is conducive to safe care and that also protects your well-being. And so some of these structural changes I've talked about, these are really important and foundational to resilience capacity building at the individual level. And, I hope that your organization is making opportunities for you to engage in self-care practices, which are really important and some things that I definitely needed to engage in as a clinical nurse. But I also hope that they're taking some ownership and looking at ways in which they can improve working conditions to support you also. And if you have further questions, you can connect with me on LinkedIn. You can also reach out to me by email. And I think that that's it. So thank you.
All right, we are opening up for questions to both of our speakers. Would anybody like to unmute and ask a question? If not, I will read some questions from the chat. Anybody have a burning question in our audience? All right, well, then I'm going to try to frame some comments in the chat into the questions on our audience's behalf. So there's some comments in the chat that, this kind of caregiving stress and strain that comes from needing to prioritize your care recipients' needs first, is not only applicable to kind of nurses and their patients, but also to parents and children. And it's very difficult to kind of be a caregiver in multiple aspects of your life, right? I would assume that when you are a mom or you're caring for an older adult and then you go to work and you're kind of giving. And so Emily here is telling us that we need to develop a consistent habit and every day do something for ourselves. How do you find energy and strength to do it? And why do we need to do it every day, Emily? Like, can we just do it like on Mondays for 15 minutes?
As a start, why not? Anywhere where you can start that way. For the people in our study, and like you saw in sort of the habit loop and everything, the more they did it, the more they benefit from it. And the more one person in particular turned to it every time she knew she needed a little break. And it's hard to find time, so busy at work, so busy at home, so busy with, so many things, that she would just be like, I can take 2 minutes and play my ukulele. That was her thing. And that would be so calming to her. And the more that you do it, the more that you understand the benefit of it. And so the more that it becomes routine, the more that it helps your mood and your presentation. But then I guess also thinking, like, if you were to do mindfulness, that helps you kind of bring you into the present moment and sort of center you. Little things that you do for yourself can kind of help put you in the right place, and put you to be more present with everything that's going on. And so, yeah, I think doing it every day as you can. I'm sure sometimes it's just not possible, but the more you turn it to a habit, the more you kind of really gain all the benefits from it. So, but wherever you can start.
Excellent, thank you. So what I'm hearing you say is that once you make this a priority to do it every day for a very brief amount of time, then it's going to be, kind of become built into your routine, and it wouldn't feel like this one more burdensome thing to do, but it would kind of be part of your flow. So we should all give each other and ourselves a prescription for, 5 minutes of self-care every day, right? Okay. Next question. Do we have tips for starting self-care that you don't want, but you need to do? Oh, that's a loaded
That's
question.
a very good question.
Thank you, Melinda.
I would actually start by asking yourself further, why do you not want it? And why do you think you need to do it? And really start evaluating on your own, what is the difference here? What is going on that you don't want it, but you need to do it? And so it's kind of a hard to answer question, but yeah, I would really start there by evaluating your own values. Is this based on your values of what you think you need? And then also kind of going back from that motivational aspect of, well, you don't want to do it, but how do you think it would help you? But if you really don't, do you actually think it's going to help you? Like, where is this contradiction coming from? The want to do, but you don't want to do, but you need to do. Because maybe there's an effect of what you think you need to do that you can get from a different way, if that makes sense. Like, well, I think I need to, I don't know, I'm trying to come up with something. I think I need to drink water so that I'll be more hydrated and energized, but I hate drinking water. If you're drinking water to be energized, exercise. Okay, that's a good one. Thank you for a good suggestion. Okay, so you don't want to do exercise. Oh, thank you. Okay, so you don't want to do exercise, but you need to do it. So that is the same thing of, why do you feel like you need to do exercise? What is it that you're trying to get out of the exercise? Is there another way to get what you get from exercise in like a different manner? Or with exercise, is it coming up with solutions and accommodating for it? So if you don't like, being sweaty, is it setting up more fans to kind of keep you cool? Or kind of what is it that seems to be the barrier there? And how can you kind of start to address that barrier? And sometimes it can be motivation. I'm not like really enjoying exercise myself. I only like to play tennis. But I start off so small. Like, that's why I would say I would just run a half mile. I know I can run more, but if I get myself on the half mile, then I'm like, well, might as well keep going the whole mile. Why am I going to stop now? And it's like anything that you can kind of reduce, if it's like a motivation or if it's like some sort of resistance, anything you can do to kind of resist that to make it more achievable and more desirable, is good. Thank you. That's a good question.
Excellent question. Thank you very much. Next set of questions is for Amelia. Amelia, how do you have any suggestions on how to help our nurses get buy-in from management for implementing the types of culture change that you recommended? And we got a compliment and a comment for you. Thank you for suggesting kind of connecting with other colleagues and kind of expanding your network of influence. So how do we get buy-in?
Yeah, that is hard. And I recognize that I'm speaking to some frontline providers and how challenging that can be to navigate those relationships with, senior leadership and management and maybe your direct supervisors. So that being said, I think that, leading with your well-being is important, but, fundamentally, there is a tie, and research has shown this, between clinician well-being and patient care and patient outcomes. So the argument, or it's not even really an argument, but the evidence shows that nurses need to be supported and clinicians need to be supported to do good work, and ultimately it affects patients. And so kind of one of my strategies has been to make it about patient care and patient outcomes. And these are some of the things we need to do to make sure that nurses are in a good place to take care for patients. And that's kind of one of my approaches to framing it to organizational leaders. I would say one of my other approaches, and when you think about approaching leadership, is how can you partner with them? And so instead of becoming, adversarial, and I recognize like why you might feel the need to, I totally see why that might happen, but how can you partner with your leadership and management so that you can build efforts that align with their needs as management, but also your needs as a frontline provider. And so I think the Wellbeing Governing Board might tap into this if you don't have one already, or a well-being committee. Maybe this is something that you could bring up to your leadership as an idea. And I think that this would be a great chance to bring in frontline direct clinical colleagues who have really insight into some of these, factors that have affected your work, but also great face time with some of the leadership who are making decisions. And so I'm hoping you have a balance of representation and that this would kind of help you come up with meaningful solutions that benefit, I would say, both organizational needs and clinician needs. So I hope that answers your question. I'm also happy to connect offline about this too.
Well, very important question came in a chat. When you advocate for these organizational changes that, the literature and the guidelines recommend, how do you protect yourself? And how do you kind of feel that you don't jeopardize your own standing with an organization when you are speaking up maybe against an unhealthy organizational culture?
Yeah, this is complicated. And I think that, as a frontline provider, it's asking a lot of yourself to take on changes, to have to redesign an entire organization. And I would not say that I expect that of you. And sometimes it's important to look at, maybe there's an opportunity to transfer to another unit that's within your organization that maybe has other support mechanisms. But I wouldn't say that it is your responsibility to change the organization's culture. That is leadership and management. There are ways that you can partner with them. And if they are open to partnering with you, I think that there are opportunities for you to improve things, but it goes both ways. And so if you can kind of keep it about what are we doing for patients, how can we align patient care with nurse well-being and clinician well-being, I think that that's the way to start. But ultimately, you do have to protect yourself and your well-being, and your organization has to be, a strong leader in this area too. I hope that answers your question.
And I think, I know we're talking about exhaustion and burnout, but, most organizations have work groups and committees that kind of looking at climate, looking at culture. So if you do have passion for this and time and capacity, volunteering kind of to be on these work groups and service committees could amplify your voice, and this wouldn't be your singular voice, right? You would be informing kind of the goals and the communications made by those committees and the recommendations that are made to the leadership. So I just found in my own career, volunteering for these types of work groups really helps to amplify your voice and kind of move things a little bit further, move the dial further than just a singular voice as a clinician. Any other questions or comments? Thank you very much for all your kind compliments to our amazing speakers in the chat. And thank you so much for taking time to connect with us today. And thank you for all that you do. We are wishing you most incredible kind of Nurses Month, celebrating you. We celebrate you all day, every day, all year. But again, thank you so very much for all that you all do for us.
So I just wanted to thank everyone for coming as well. I know Emily had an exercise that she wanted to close with, but I just wanted to, you've really given me a lot of things to think about, both personally and professionally. So I'm so thrilled that you came and presented your information to us. Thank you.
Listen. Thank you so much for this time and for participating here. I thought it'd be nice to sort of just end with a very, very brief mindful exercise. And before I go into it, I just want to take a quick couple of minutes to talk a little bit more about mindfulness. Some of you might be already familiar. If so, that's great. This will just be repeat information. But the practice of mindfulness has to do a lot with being present, accepting the present moment, not having judgment, and being compassionate. When you think about being mindful, a lot of people say, gosh, how do you expect me to not think about anything for, 30 minutes? Yes, that is very hard, but the practice of mindfulness is more accepting of wherever anything is at. So if during this practice, which is just going to be a couple minutes, if you have a thought of, oh my God, I have to do this thing at 2 p.m., acknowledge the thought, say, okay, I am thinking about that, and then just let it go. And then maybe 10 seconds later, oh my gosh, yeah, that 2:30 thing, I got to get to that. Again, just acknowledge the thought. Don't get upset at yourself. Like, what's the matter with you? You can't be calm for 5 minutes. Don't, beat yourself up about it, but just continue to be compassionate and say, okay, just acknowledge, accept, I have the thought, and I'll let it go. So please just try to be really compassionate and nice to yourself as we do this, and just, try to just be in the present moment as you're able. And if you're not, that's okay too. Okay. So if you don't mind getting comfortable, you can close your eyes, you can turn off your camera if you'd like, but just get comfortable to wherever you are seated. And if you feel comfortable closing your eyes, you can do that too. So I'd like you to start by just taking in a few deep breaths. And each time you exhale, just feel your body relax further into your chair. And just a couple more breaths. Just noticing the air as it goes in and out of your body. And as you exhale, feel your body relax further into your chair. So now I would just like you to take a moment to focus on your feet. Feel any sensations that you feel on your feet, whether it's the socks, the pressure of the floor, if it's cold or sweaty. Anything is okay, and just feel your feet. And if thoughts come into your head, that's okay. Just acknowledge it and allow it to exit your mind. Now I'd like you to just focus on your legs. What do you feel in your legs? Are they tight, loose? Maybe you feel the clothing. But whatever you feel on your legs is okay. And just take a moment to feel any sensations in your legs. Next, turn your attention to your hands. What do you feel in your hands? Are they warm or sweaty? Maybe you can even feel the pulse of blood going in and out of your hands. But whatever you feel in your hands is okay. And just take a moment to feel your hands. And now let's move to your face. What do you feel on your face? Is it warm, cold? Do you feel the air around you? But whatever you feel on your face is okay. Just take a moment to feel your face. And lastly, take a few more deep breaths in and out. And maybe imagine breathing in good, happy, positive air, and breathing out any negative air that you'd like to get rid of. positive air in and negative air out. And when you're done, you can open your eyes and come back. Thank you very much for participating.
Thank you very much. And everyone will be sending out a link to all of our staff. And if you found this helpful, please talk it up to your friends and we'll have it there for you. Thank you so much. Bye-bye. Happy Nurses Month.